Frinhan da Crioso. Good afternoon and welcome to Public Health Network Cymru's COVID-19 webinar series. My name is Christian Heathcote Elliott, Principal Public Health Practitioner with the Wider Determinants of Health Unit, and I will be today's facilitator. Today's webinar will be considering the wider impacts of the pandemic on children, young people and their families. And I'm delighted to welcome Dr. Claire Thomas as our speaker. Claire is a consultant paediatrician with a specialist interest in safeguarding. She's also a designated doctor with the National Safeguarding Team and paediatric lead for the Child Death Review Programme within Public Health Wales. Claire has trained and worked for most of her career in Birmingham with time overseas and in London, and she moved back to Wales about 4 years ago. She's passionate about improving the outcomes for children and young people within Wales, and during the pandemic she became particularly interested in how COVID-19 was affecting the young population and what might be done to mitigate against the long-term effects. Before introducing Claire's presentation, just a few housekeeping rules for today's webinar. After the presentations, there will be a chance for you to ask your questions. Please use the question and answer box in the panel at the top of the screen throughout the webinar. The webinar today is being recorded and will be made available on the Public Health Network Cymru's website after the session. English and Welsh subtitles are available. These can be switched on using the button at the bottom right of your screen. However, we do make it aware that the Welsh captions aren't totally 100% accurate. If you experience any difficulties with the technology, please let us know through the question and answer box and a member of our team will contact you directly. So without further ado, I'm now going to hand over and welcome Claire.
Thank you, Christian, for that lovely introduction. I'm just going to share my slides now. So yes, as Christian said, I'm a consultant paediatrician specialising in safeguarding, but I also work at the Sexual Abuse and Rape Centre, seeing children within Cardiff, seeing children who may have been sexually abused, as well as my two other roles, which Christian explained. And I think really, you know, a long time ago, like beginning of last year, I started to really wonder about what's happening to our children and young people. How are they managing? You know, there's a lot of hidden harm anyway, but that hidden harm's even more hidden during lockdown and the pandemic. And as time's gone on, I've followed it with interest, really. I'm not an expert in COVID-19 from a paediatric perspective, as I'm a safeguarding paediatrician, but really this is from a personal interest that I'd started to get interested in this. I was asked to do a podcast by the Public Health Network Cymru last year, and I think that was why they asked me to come back and do today. So, so what we're going to do today, really, a little bit about COVID-19, a very little bit medical bit, because I'm aware that most people aren't medical, a little bit about how it affects children and young people, but more really about, oh goodness, sorry, more really about you know, how it affects them more in the more broader sense, about education, about lockdown, and then moving on to some surveys which happened to look at how the children were managing, what they thought, what they felt, and then finally moving on to resources and things that have been put in place across Wales to try and support the children and young people as we move out of the pandemic sort of phase and more into the new normal.
Apologies. Hi Claire, it's Casper.
Yes.
Are you having issues just clicking through your slides, or is it working?
No,
now?
they have. That's the first one just come up now. Can you see it?
Yeah, we can see it. Excellent. Thank you very much.
No, I was just talking first, so that's fine. So firstly, I like this quote. This is from a publication in the British Medical Journal last year. The coronavirus 2019 pandemic is undoubtedly the biggest public health crisis since the Second World War. Its consequences we felt for many years to come. The outbreak spread at unprecedented speed across continents, resulting in illness and death, particularly amongst the frail and elderly. But actually, lockdown measures reduced the risk of COVID, but had unintended consequences for children. And I think that's what we're really looking at today. And you might wonder why I've put a picture up of Sesame Street, but actually, you know, public health bodies across the world have been thinking about COVID-19 and thinking about how they're going to address this. And Sesame Street actually had a lot of big public health messages and themes. This is an American, this one was an American one, which is about the ABCs of COVID and about just explaining to children and young people. And I'll come back to Sesame Street at the end just to show you some other really interesting things that they did. But it just shows that, you know, that a pandemic is truly affecting everybody when even our children's television programmes start to have public health messages threaded within them. Is other slides clicking through now, Casper? I'm assuming no news is good news, so
yeah, your slides are clicking through, Claire. You're good to go.
Thank you. So a little bit about COVID and how it affected children first. So an unusual feature of the pandemic has been the relative sparing of children and young people. So overall, it's thought to account for between 1% and 5% of all COVID-19 cases. What I have to say to you all is that all of the figures throughout this are actually from papers that I've read, and I have a bibliography at the end of all the different papers. So if anyone's particularly interested in this as well, I'm really happy to share my all the different papers and things that I read, but I haven't referenced them exactly all the way through because I got a bit busy. So obviously 1 to 5% of COVID-19 cases, but interestingly, we think of children being mildly affected, but between 1 and 5% of those tested developed severe or critical disease. Now that's quite a wide branch, 1 to 5%, but actually what we found was that early on studies looking at severe or critical disease were saying 5%, and that's really because we were doing a lot less tests, and we definitely were testing less of the sort of less symptomatic children, and I think the later studies that have been published are now quoting more like 1% of children developing severe or critical disease. Most children were mild and asymptomatic, and there's been very few deaths reported worldwide, but I do talk a little bit about UK-wide deaths and in particular Welsh deaths in a slide in a few time. There's some evidence that they may have a lower susceptibility to COVID-19 and a lower odds of being an infected contact, and I'll talk again about that later on. There's some thought that children may have a different responsiveness to angiotensin converting enzyme receptors. That's the most medical I'm going to get, don't panic. And I have to say, I certainly don't understand it. I think that there are many people, you know, looking at this at present, and I think as time evolves and more research happens, we might start to realise why children are less affected, but all we know at present is they appear to be. There's some evidence that they play a lesser role in transmission at a population level. There were some studies, there's been lots of studies looking at schools, particularly Greece, Norway, the Netherlands, Israel, China, and also we're now looking at some from Britain. But there was one publication which stated that if you had a child who tested positive in a class, then you were likely to get 2 secondary contacts from that. But if it was one of the adults working within a class, then you were more likely to have 9 secondary contacts. So there's definitely something about the differences between children and adults, although I must put a word of warning in here, but actually adolescents and teenagers tend to act more like adults, you know, I suppose because they are evolving children into adults, and so they're much more infective. And again, generally it's been shown that within households, children have been shown to be lower in infecting other people than adults. So really the first thing just says that the data throughout the world is unlikely, showing that they're unlikely to contact with each other within schools, and that household transmission is most likely to be the mode of contact. There are some very serious outcomes from children who do get COVID-19. It's extremely rare, but PIMS is a really unpleasant, extremely difficult to treat disease, paediatric inflammatory multi-system syndrome. It's about 0.5 to 5.8% mortality, so really very high when you think that children have very low chances of dying generally from most diseases. But so there is a serious side to COVID-19 in children. There are now studies evolving looking at which children are more likely to have more problems. And really it mirrors that of adults. Children who are medically complex, who might be on technological support, like those who might be ventilated or have a tracheostomy, those who are developmentally delayed. Interestingly, children with genetic abnormalities, particularly those with trisomy 21 or Down syndrome, are more likely to have more severe disease. And those children with heart or chest comorbidities. But that isn't just somebody with mild asthma or moderate asthma, it's usually very significant other conditions. And again, mirroring adults, children who are obese are at more risk for more significant disease. Ethnicity again mirrors adults. There's been an increase in Black ethnicity children who are admitted to hospital, and also again this group were overrepresented in those who needed critical care. And then 69% of children with PIMS were either Black or Asian ethnicity, so there's definitely some more work to be done looking at that. I've mentioned about teenagers already. There's now some evolving evidence coming out that children are at risk of long COVID, but it's likely to have a slightly different progression than with adults. A lot of my talk is going to be about mental health and about the things that have been done to try and support children with mental health issues following the pandemic. So I've just put this in here for completeness, but actually we'll talk about that in much more detail in a few slides. This was just an interesting snapshot. They early on in the pandemic, paediatricians across the country became worried that we weren't really seeing as many kids. They just didn't seem to be presenting, and we didn't know if it was parents were scared, parents were worried about bothering people who were very busy, or people were worried that actually didn't know how to access services because it was a very different situation. So the British Paediatric Surveillance Unit set up a snapshot survey of all the consultant paediatricians in the UK and Ireland. And for once, we all responded, or pretty much nearly all of us, 60% responded. So those working in the emergency department or assessment units reported about 32% people said, yes, I've seen delayed presentation. And the conditions which were the most commonly delayed were overarchingly, the highest was diabetes. And that was a combination of people who were presenting with new diabetic presentations, but also children who were established diabetics, but who then presented with complications of that, like diabetic ketoacidosis, where their sugars had got completely out of control. So that was the biggest worry at the time. But also they were talking about the fact that children with infection were presenting late, and also some children with new malignancies or cancers. The paediatricians working on the wards said they saw some delay, but less than the paediatricians in the emergency departments. Neonatal consultants working with newborn babies and in the first month of life said that they were seeing late presentations during labour, because they were late presentations during labour, and then they had adverse maternal neonatal outcomes. And then sometimes the children were being discharged earlier, perhaps without having their feeding fully established. And then sometimes the children were returning with feeding difficulties or dehydration. I have to say, this is very early on in the pandemic. Obviously things have returned much more to normal by now. Community paediatricians, of which I'm one, we were concerned about the fall in referral rates for child protection assessments, and I've got the next slide talks about that. And oncologists felt that they weren't seeing enough children as they would normally expect with new cancer diagnoses. So really quite worrying at the beginning, but I do think that messages about we're open, business as usual started to trickle through, and things then settled back down to normal. A little bit about deaths of children and young people, and I'm sort of going to do this backwards really, because I'm going to talk about the bottom of the slide first, because that's where we all work within Wales. There were children reported to have died across the world, generally very, very low numbers. I don't know if you're aware of how the Child Death Review programme works within Wales, but I'm going to tell you anyway, because just in case you don't know. So we're a small team, and what happens is we have information about all deaths of children who die within Wales up to their 18th birthday, and any Welsh resident children who die outside of Wales. We get multi-agency data in. We get it from the police, social services, health. We get it from the newspapers. We get it from all over the place. We have a database, and we analyse and collect all the data on all child deaths, and we then will categorise them, but also raise issues if we're concerned that there might be a problem with an increased incidence of something specific. Then we might raise that with appropriate agencies, or sometimes people come to us and say, we're a bit worried about this, have you seen an increase in this? So it's a really important role, I feel. We have very low deaths. We have about 200 a year in Wales, and for the reason for that, again, our COVID deaths were extremely low, and so low that I'm not going to talk about them particularly, because they would make the patients identifiable, really, because they were so low. But I'll talk a little bit more about the deaths in England, because they have more, so it's more possible to discuss that. The sort of work that we were doing during COVID was things like we were asked to look at suicides to see if there was an increase in children completing suicide during the pandemic, and we did a rapid review and actually found that the figures were fairly similar to the year before, which was, well, it's a tragedy if any child completes suicide, but it was a good thing that things weren't increasing. We also were asked to look at a rapid review of whether more children were dying from sudden unexpected death in infancy, where they had been sleeping in a bed with a parent who'd ingested alcohol. So things like this, when they're raised to us, we'll then look into. So we also looked at another group, and this was really what triggered my interest in COVID, really, was we were looking at the COVID related deaths. And these were not children who had COVID or who tested positive, but these were children where somebody had mentioned on their paperwork that the child was very anxious about COVID and then completed suicide, or that actually it was a delayed presentation because the parents were anxious. So we then started looking in more detail at the COVID related deaths. There were very few, and virtually all of these were in the very, very first instances of the pandemic. And I'm pleased to say that they have reduced down to a significantly lower level. But the things that we found initially were things like delayed presentation, worrying about access to services, not knowing how to access services. We did pick up that there was a higher prevalence of ACEs in the children who had had COVID related deaths. And like I said, we did look into some of the children who'd completed suicide had mentioned isolation and worries about COVID. So so moving on, because our numbers are so small that I think it is better to really look at this study, which is above, to look at broader themes. This is a pre-publication journal article. It's pre-published, so it hasn't been peer-reviewed yet, but it's unlikely that the data will change because it's been done by a very reputable team of people. And this is looking at the mandatory child death data system in England, and they actually married it up with the Public Health England data looking at COVID positive testing as well. So it was a really interesting study. So in that year they had 3,100. If you compare that to Wales with 200, 61 of these occurred in children and young people who tested positive within 30 days of their death, but they categorised only 25 of these actually died from COVID, which meant that 99.995% of children and young people in England with a positive test survived. So really very, very low morbidity and mortality, which gave a mortality rate of 2 per million. And although we can't share the exact data, our mortality rate would be significantly lower than that, although very small numbers, which makes it more difficult to get an accurate rate, but significantly lower than that. So Moving straight on to education. So why are all the paediatricians up in arms about education? Well, you know, obviously the evidence was coming out, particularly from this setting, the ECDC, European Centre for Disease Control in Stockholm, and they were publishing large reviews of all of the data saying that younger children do not contribute significantly to community transmission. I mean, I suppose later on we might have, you know, maybe they would change that slightly. That was at a time when we were worried about super spreaders. We know now that children had asymptomatic and mild infection, and they felt that physical distancing and hygiene measures need to be applied. And interesting that they're based in Stockholm, although it is a pan-European setting, because obviously Sweden didn't really follow a lockdown. So anyway, but they are having problems now. UNESCO commented at the time, when schools closed, children and youth are deprived of opportunities for growth and development. And they pointed out, as we know, that those underprivileged learners, the ones who are more likely to have more difficulties at home, are the ones who are going to suffer more. And that's certainly what we've seen in Wales. So why is it important? Well, you know, it's not just about learning, it's not just about reading and writing and learning about the planet. You know, you learn so much more from school. Healthy eating, you learn from your peers, social skills. You might have a family who aren't particularly into exercise, but you learn that you're really good at football. You know, my little boy loves the fact that he's learned how to brush his teeth, and he'll stand there while I'm brushing mine, go, you haven't brushed yours for long enough and you haven't done the backs, you know, and that's a really good life skill, and clearly I would have taught it inappropriately if I'd taught him, you know, and they get used to routine and structure. For many children, school is a safety net, and it's their place of safety. It's often the place where they get fed, where they don't get fed at home. It's often the place where they're able to then share that they're not safe at home. And that loss of interaction was something that the ECDC were very worried about. And I think when we look at the later surveys that have happened in Wales around COVID and lockdown, we can see that actually that loss of interaction was significant. Now, I mentioned the youth ambassadors here, the young ambassadors for Public Health Wales. Here, they don't completely fit in here, but I think it's really important to mention this and show you what they taught me, really. Early on in the pandemic, I had a conversation with our chief executive. We were talking about worrying about children and talking about innovative ways to try and access them. You know, should we be using social media? Should we be using TikTok? You know, how do we get messages out? And so I went along to one of the Young Ambassadors Public Health Wales meetings. And it was daunting, probably almost as daunting as speaking to you all today. They grilled me. They asked me questions I didn't know the answers to. Probably going to have the same today. It was really interesting. And I said to them, you know, how do you know how to keep safe, and what sort of ways would you use? And I talked to them about social media. And the social media that an adult thinks about is completely different. So, you know, I was saying Instagram, Facebook, TikTok, Twitter, you know, there's loads more which the children all know about, and they change all the time, and you wouldn't be able to access everybody because not everybody accesses the same ones. And they really felt that it wasn't an appropriate way, and they were really interesting because they just said every child has a school, well, should have a school, every child is having that link in with school, and actually they felt that all of their messages should be coming through school. They felt that their wellbeing, their saying if there's a problem, all of those sort of things, their how to stay safe, their sexual health, all of those things they felt were best linked with school, because then it was a universal plan. So it really showed me that I know nothing about young people, and it's really important that we ask them, and that's why we have them, I suppose. So I'm sorry. Well, I say sorry, but I'm not really sorry that, you know, as a safeguarding paediatrician, you're never going to get me to speak without mentioning safeguarding. And I think that a study in Child Abuse and Review published at the very beginning of lockdown, where they said lockdown has been particularly difficult for children and young people, was actually an enormous underestimate. Lots of things were being done to try and help children keep safe, but we were all moving so quickly, weren't we? And things were changing, and it was also unknown, and we're in a different world to what we were used to. The government published a new guidance on keeping children and young people safe, which was a sort of a rundown of all of the different referral mechanisms and how all the different things that professionals would need to know, which was circulated to every person in the country who would be working with children and young people. So that was really helpful. And in the government's looking forward publication this year, they recognise that when schools shut down, children and young people are unable to find a safe place away from violence at home. And they recognise that calls to helplines in Wales increased by over 50%. And the United Nations again have said that children are not the face of this pandemic, but they risk being the biggest victims. And this crisis is having a profound effect on their well-being. So lots and lots of people recognising that there are real struggles for our children and young people. I'm not going to talk a lot about violence against women and children because the Violence Prevention Unit in Wales does enormous amounts of work, have done lots of publications into this and webinars, etc., and they are much better placed than I am. But just to signpost them and mention them, you know, obviously a really important amount of work which is being done by them. I mean, the executive director for women for the UN, who I can't name because I can't pronounce her name, said that actually the violence against women was a shadow pandemic during COVID. And I think that's what we would find as well from being in Wales. Violence Prevention Unit, the latest health-based assessment they presented, looking at COVID-19 on children and young people's experience of violence and ACEs, said that they found that there was an increase in alcohol consumption, particularly in those houses where they had an under 18-year-old, increased child and young person witnessed domestic violence. They quoted an increase in children experiencing physical abuse, which I found interesting because, as my next slide will explain, we had some issues as paediatricians about this. Obviously loads of issues about mental health, which we'll explore. And also really important to remember the increased risk of online abuse and exploitation via online methods, because these children were not in school, they were working from home, they were using computers, they may not have families who are IT literate, etc. You know, they are absolutely just ripe for being exploited. So you know, obviously the VPU made many recommendations after this and said that they're likely to have an adverse effect on the child's experience of violence and ACEs in the long term, unless there are mitigating steps, which of course there have been many, which I'll move on to. So just to marry up with that about the increase in physical abuse, we were really worried as paediatricians because we just weren't seeing children for child protection medicals. And I don't know if you would be aware, because obviously you may come from different backgrounds, but what happens when a child gets to the paediatricians is, you know, somebody makes an allegation of physical abuse, and there is usually a multi-agency meeting between police, social services and health. And then a decision is made whether the child needs a child protection medical with one of us to look at their injuries and see what may have caused them. And this was just reduced to virtually nil in many places across Wales and in fact across England. Emily Payne from Bridgend, you know, published a report saying how low the facts were in Bridgend. There was a larger study published by the Birmingham Child Protection Team where they were seeing 40% less children than in the year before and the year before that. Sexual abuse referrals for children across Wales significantly reduced. But interestingly, at the time, we were concerned because we weren't seeing them, but the helplines were having an increase in referrals. So we actually, Welsh Government arranged for and the Children's Commissioner arranged for a meeting where everybody sat down together. And interestingly, actually, it was the police and social services were also not getting the referrals in. So it wasn't that they were sitting there, they just weren't coming to any of the services. Having said that, now things are way back to normal. In fact, way higher than even pre-pandemic levels, and we're certainly seeing some of those historic cases which didn't come through during the pandemic. So that moving on really from what has happened to what have people been doing about it. And the Children's Commission for Wales published 2 very large surveys where they surveyed children and young people in May and January this year. Really important to really get that voice of all these children and young people. She noted that, you know, she recognised that the children's human rights were being restricted during this time. I mean, you know, and absolutely they were. And it was just this balancing act between keeping safe and actually letting people have freedom. But in the survey of 23,000 children, it was really important to note that the survey had disabled children, it had a broad spectrum of different people from different demographics and different ethnicities. So it was really, you know, really good survey. And 63% of the children said they were worried about coronavirus. Mostly they were happy, 58% they were happy most of the time, and nearly everybody felt safe. Their main worries were unable to see friends, family, and their schools being closed. Only 31.9% said they knew how to seek school counselling if they needed it during the pandemic. 51% said home learning's okay, I'm confident, and only 2%, it was actually between 1 and 2%, said they'd not heard from school at all. So the barriers were things like IT and equipment, which rapidly was addressed, but also they just wanted more contact with school and more contact with their friends. A positive was that 53% said they were playing more and actually having more fun, you know, at home, if you like. But a negative was that there was a significant reduction in children able to use Welsh, and it was particularly those children whose parents don't speak Welsh, who live in non-Welsh speaking homes, and those children who attend English medium schools. So then it was repeated in January this year, and sadly, really, you know, less positive, really. Some positives, but overall less. The children were generally less happy, said they're missing friends, teachers and their experiences. The bigger children were worried about exams and their future. 30% of them said they were worried most of the time. And half the children said, well, I'm enjoying learning from home, but I'm worried I'm falling behind. For the first time, they asked about loneliness, which they didn't ask previously. And across the board, the loneliness rates were high. Disabled children were more likely to be worried, sad or feel unsafe. And Black, Asian and ethnic minorities were more likely to feel lonely or less safe. So Professor Sally Holland said, while accepting our overriding priority must be on preventing death and serious illness, there are many more dimensions to children's lives that need to be considered. So she's really thinking about the wider picture. And I've just put up the box in the corner. I really like this strapline. So the question is, what will young people need to support their mental health as we emerge from the pandemic? And as a paediatrician who makes many referrals for mental health support for my patients, I just never seem to get it right. Whoever I refer to, it seems to get bounced back. I clearly, you know, I've worked in lots of different places and it seems to be the same. And actually having this no wrong door responses for 2021 and beyond is really helpful. If that's particularly helpful for parents and children who are seeking help themselves. Because once you make a referral, or children refer themselves or parents, and then it gets bounced, you get more and more of a time delay. So I think this is a really fantastic strapline, and I really welcome it starting to work across the country. What else is going on? So Health and Social Care, Welsh Government published their Health and Social Care in Wales Looking Forward report this year, and they recognised that deprivation, domestic abuse, substance misuse and mental health had worsened. They also recognised that children and young people in care had been impacted by lockdown arrangements, and that although use of online contact with children for contact with their social workers and contact with their families was helpful, it's not the same as having face-to-face contact. So they really said that they felt that getting flow back into the system was key, allowing children and young people to safely leave care, but whilst also identifying hidden harms that have resulted from COVID, making sure that appropriate services are in place, and also to continue to support families to stay together. So a really, really ambitious and helpful document. And then we looked at it, and then there was lots of work looking at children and people's mental health and coronavirus. Young Minds is a UK-wide charity. They commented that there'd been a devastating impact on the pandemic on young people, with main pressures being loneliness, isolation, school and the future. And that would represent what Our Children in Wales was telling our Children's Commissioner. Young Minds tend to do a sort of seasonal survey, so they've been doing one like winter, summer, spring, autumn, and the latest one published was January. And the children said 75% agreed that they had found the current lockdown harder to cope with than the previous ones. 67% said they think that the pandemic will have a long-term negative effect on their mental health. And 79% agreed that their mental health would start to improve when restrictions were lifted. And so there were some recommendations made from this, and I list them really here because they really link in with what has happened in Wales, which we'll talk about in a couple of slides. The recommendations from them were wellbeing is a priority in school with catch-up planning, inconsistent mental health support available through schools, really important to keep those local charities and youth clubs which might have struggled during coronavirus, really important to support them to keep going, and that everybody knows how and where to find support. I'm not going to talk about the last publication, but it's interesting if you're particularly interested in this. It's again a Welsh Government review of all of the review of mass disruption, the wellbeing and mental health of children, but also comparing it to children who lived through mass disasters. And I think that from a countrywide view, I think that you can understand why they would have put those parallels in. So what are we doing about it? So there's lots going on. This is not exhaustive. This is just the things that I've found, that I've heard of, that I think are good. There's probably loads more that you all may know about. The Young Person's Mental Health Toolkit in Wales is fantastic. It's really interesting because it's very much designed for a young person, and I'm obviously not. And it's very much, like it's designed like a playlist, like an app that children would be very used to using. It feels like it would be child friendly, and I'm sure they had lots of input from children when they did it. It's got information, it's got self-help, it's got signposting, it's exhaustive, it's really good. If I have time, I can show you it at the end. In February of this year, the government announced significant investments in mental health services, and 9.4 million of this is for children and young people's mental health. And as we link back into the last slide about the Young Minds recommendations, 4 million of this was earmarked to improve access to emotional and wellbeing support in school. So that's fantastic, isn't it? The children are saying this is where we want our support. That's what the evidence is saying, and this is what's been earmarked. 5.4 million in addition for CAMS. There's also been some CAMS in reach into school projects and schemes across the country, which were found to be really quite positive, and so they're querying whether to increase the CAMS in reach scheme into schools. Young Minds again has lots of resources. It's a charity. It has a text sort of helpline, and to me, I'm like, if I'm in a muddle and I need to talk to someone about my mental health, I can't imagine just texting, but that's what kids do. They're really used, they don't ring each other, they don't pick up the phone, they're so used to texting, and so actually this really fits with what young people need. But there's also all sorts of different things on the website. It's really good. You can do things like, you can click on it and say, I'm feeling angry, and it will go through anger management, some little techniques you can do, why you might be feeling angry. I mean, it's just a very well thought out website. Mind, again, is a mental health charity, which is adults and children, but they also have lots and lots of resources. And particularly, these resources are particularly useful for those children who've been referred in for perhaps CAMS, and there's information about what to expect and what you might need to know. The next one is the Mix, and the Mix is another interesting one because, again, this is a helpline, but it's not a helpline, it's a web chat. So children can go onto the Mix and they can talk in real time with somebody, but it's all via web chat, which again really fits with what the children really want. They don't want to have a chat face to face half the time. So, or certainly not my son anyway. So The last one on here is just the most lovely website. It's Dr. Liz Gregory, who's a consultant clinical psychologist. It's her own website. It's her own blog. In fact, the picture on the side I've pinched from her blog because it's just a lovely rainbow with hope underneath it. And on her blog, she's just got loads of techniques about how to deal with this, how to deal with that, and it's just some really accessible, helpful things for children to access when they've got, you know, issues. So it's really worth looking at that. What else is going on in Wales? So we have Mae'r. Mae'r is a helpline for children aged 11 to 25. Excuse me a sec, I'll just sip of water. Too much talking. A helpline for children under the age of 25 from 11. It is Welsh Government funded and has been running for really quite a long time. It's really helpful. Again, it has a helpline. You can speak to somebody between 8 in the morning and midnight, and then after that time they signpost you to other agencies. It's got so many resources. It's got loads of stuff about COVID, but it's also got just really helpful little articles, you know, what to do if you're worried about your sexuality, what to do about knife crime, what to do about I don't like wearing a mask, you know, what do we do about bullying, all these sort of things, just things, you know, puberty, you know, all the things that kids, you know, adolescents start to worry about. There's just really accessible, nice articles on there. So that's really useful. Stop It Now is a campaign by the Lucy Faithful organisation to try and reduce child sexual abuse. And there is a campaign across Wales as well, and there is a national helpline which is for adults and children who are concerned about child sexual abuse, which is really invaluable. Live Fear Free is not just for children, but it is a Welsh free helpline to help people who are suffering from domestic violence and abuse, particularly women and children. The Public Health Wales website, the internet, it has a wealth of resources. You know, virtually everything I've talked about today is actually on the Public Health Wales internet. And I think because of the pandemic, people who'd never even heard of Public Health Wales now look to it as a source of places to look for advice. So it's really good that there's a whole section of all sorts of different advice on there. The NSPCC continue to be a big resource. Again, their website's fantastic. Save the Children have a really nice campaign going on, which is about talking to children, and they have a whole thing on their website about how do you talk to them about difficult things, bereavement, COVID, all those sort of things. So it's a really useful resource. And finally, last but definitely not least, the Children's Commission for Wales has an amazing website. It's got an information hub for children and families. It's got things accessible for children, accessible for families. It's got signposting, it's got advice, it's got you name it on it. But it's got some really nice articles, things like, how do I learn when I'm trying to work from home? Hopefully we won't be doing that again, but you know, and what do I do? How do I play with my kid? You know, what are good things to do? There's a whole load of sections about mental health, and there's lots of information about education and COVID. So really a really useful, you know, well-used website. So finally, I said I'd come full circle. I know that the children, when I spoke to the young ambassadors, said to me, yeah, you know, social media, not really for us, but there is a role for media. And certainly Sesame Street have been sending out their public health messages wide and loud and proud across the whole world. So these all look similar, but I'll just tell you what they all are. So this top left one is a lovely one made by Sesame Street in Jordan. And it's about social distancing and why we have to stay safe in Arabic for Arabic television. The middle one is just a poster which I like, and it says, stay at home, do like Oscar. And that's really cool because Oscar never wants to leave his bin, so he wants to stay at home all the time. This top right one is a programme which they developed purely for children with autism to try and explain about COVID. The bottom two, I don't know if you know, but Sesame Street has Mae's Minute, and Mae is Elmo's mum, and she has a minute, or it's more like two, where she talks about things like a theme. And there was one which is about coronavirus, about what she did with Elmo when he was at home, and how she found it a bit difficult, and how she taught him, and all those sort of things. And it's just a really nice little vignette, really. And last but not least, the bottom one here shows Elmo dressed up as a doctor, and his dad has proudly just had his COVID vaccination. So there's a whole thing. There's been a lot of negative press about COVID vaccinations in America, and so I think they're really trying to get back on this with the pro-vaccine message. And so this was taken from that. So thank you for listening, if any of you are still there. I'm really happy to answer questions. Like I said, I'm not necessarily an expert, but I might be able to signpost you. And if anyone's interested in all of my references, I'm really happy to share them.
Thanks very much, Claire. That was a really comprehensive and broad presentation you gave. In fact, I just had a couple of questions, really. I wondered whether there had any research have been looking at the sort of effects on attachment styles. So I'm thinking about younger children and how the pandemic, you know, in terms of how caregiving has changed during that and the lockdowns, and whether that anyone's looking at how that may influence attachment styles.
I have to say, I think yes, but I don't think they're out and published as yet. And I think that will be really interesting, because I think, you know, I think attachment's very much linked in with, you know, good attachment and good parenting styles gives you good outcomes. But children who have disadvantages are much more likely to have much more difficulties later on. And I think it's almost too early to have been for it to be looked into, but I think there will be. But unless anybody else knows of any which are,
sorry, Claire.
I was just going to close. Shall I just close this so I can see you, because I can stop sharing?
Okay, so we've had a few other questions asked from the audience. So this question is from Ruth. So going back to the beginning of your presentation, of the COVID deaths of children, do you have a feel from that data you showed us how many had a diagnosis of learning disability? Quite a specific question, but any sort of feelings around that?
Yeah, I mean, the data was from England, and no, they haven't said that in their actual paper. Be interesting. I don't know whether they actually would be. It would be interesting to talk to the English Child Database to find out if they actually record learning difficulties, because I wonder whether that's something they'd actually even be able to look back at. But yeah, no, so no, it wasn't covered.
Okay, thanks. And another question related to COVID-19 related deaths in children and young people. Is there any information on what adverse childhood experiences most closely relate to COVID-19 related deaths in children and young people?
So I mean, in Wales we had such low numbers.
Yeah.
But one of the things that we really worried about was, you know, families who were already struggling, families who already had high ACEs, you know, perhaps those families who have problems with drugs and alcohol, or those families who have difficulty with learning or mental health. It's almost like they were the ones who were suffering more because they already were struggling to access, and then it just added a whole other layer on as well. So I don't know if I've completely answered that really, but.
Oh, that's so clear. So we had another question. I guess this is just maybe your reflections or observations, and it's a bit of an ethical question, really, which is about have the control measures that were brought in during the pandemic placed upon children and young people unnecessary and avoidable harms, more so than the virus itself. So I guess it's a bit of a question, an ethical question around the control measures.
So, I mean, obviously it's very personal, people's opinion from that. And as a paediatrician, I will have a really different opinion to that of a public health person. And I really appreciate that, because I'm not trying to sort out a pandemic. You know, I was just thinking about outcomes for kids. I mean, I think that if we knew then what we know now, I think we might have gone about it differently. But the thing is, you can't respond at the time. You can only respond with what you've got and do your best, can't you? I think, you know, what the government have said, what the Children's Commissioner and what the outcomes have said for children is that actually probably for the younger children, you know, the risk of what's affected them is going to be more long acting than the effects of COVID itself. But, you know, we only know that with the hindsight, don't we? So.
Yeah, I mean, I think it was a case of very much almost laying the tracks as the train is literally rolling along, isn't it? So it's hindsight is a, yeah, it's a difficult one, isn't it, in this set of circumstances. So we've had another question about do you have any observations on how young people's needs will be monitored going forwards? I guess this means in a Welsh context.
Yeah, I mean, I think our children's commissioner is probably the best. But I mean, you know, the handle that they had on things when things were going through was amazing, really, when you think about how, you know, actually, and I think that those sort of surveys, I would hope, would continue, because they really gave such valuable information. And it was interesting, wasn't it, that the charities results came out all the results asking different children came out with very similar result, you know, end points. So I would hope that those sort of things would continue. It's certainly something that the government are very interested in.
And will seem really important moving forwards if we're really monitoring whether actually we are going to mitigate against some of the potential inequalities which may roll out in the future. So we have another question related to the resources you showed. Are you aware of any specific resources to help children with additional needs or learning disabilities and their families to understand COVID? And in addition, any resources of how to cope with the restrictions or keeping ourselves safe that are specific for children and young people with learning needs or disabilities?
I think the Children's Commissioner site, they've got a lot of accessible stuff. There's bits for children with vision problems, bits for children who are deaf. I think there are children. I think there's accessible bits on there. There's also, because they had to adapt all of their work very much, because quite a lot of people who responded were children with additional needs. So they had like an accessible questionnaire as well. And I'm pretty sure on the website that there's a whole lot of resources for them. So.
Okay, thanks. And we can probably put something in the chat box around that to look in there. That'd be really helpful. And just another thought I was just thinking about, and you mentioned obviously a lot of the surveys pointed to loneliness being quite a key issue. And as children have gone back to school, and I wondered about you know, that kind of negotiating relationships in a sense, whether that you feel that's been affected and building relationships. Because, you know, for a certain cohort of children that was probably quite compromised, and just what steps might be needed to kind of rebuild that.
Yeah, I think this is really crucial, to be honest, because I think for those kids who are sort of quite outgoing and were still going to the park and bumping into people, you know, I think they may have adapted better. But I think, you know, certainly for children with additional needs or who have social communication difficulties, I think that being out of school for so long and then going back has been really hard. Lots of my patients have just struggled so much going back. I've got a son who's got additional needs, and it's, you know, having spent the whole year with mum and dad, he doesn't know how to talk to another child anymore. So I think there's really some work to be done with that. So 100%. Yeah,
thank you. Well, I don't think we have any more questions. Are there any sort of final thoughts that you would like to share with the audience? Well, I didn't know if anybody would be interested if I just quickly show them the mental health toolkit. I would say, if you want, I could just flash it up because it's really interesting. So if you don't have to, if people are, hang on, what am I doing? There we are. Now, hopefully it'll appear. Has that appeared? Yes, that's appeared, yeah. Yes, brilliant. So this is what it looks like. The children access, I think I forgot to say, they access it through the hub, and every child in Wales who is in education, which should be everyone, has a hub account. But actually adults can just access it. I mean, I haven't got a hub account, I can access it. I really like it. It's like playlists. You can see there's all these different things: coronavirus, crisis, anxiety, keeping healthy, low mood. It's really nice. And then when you actually launch it, it is literally like a sort of playlist of all the different things, and you can click on different bits to look at. You know, I just think it's really slick the way it's been done, and it's clearly been. Now I'm trying to get onto the bits which are. Yeah, here we are. So there's, you know, like a section about Mike. And it just feels very much the way that, and I have to say, to me, I probably like the old
system of appendixes and things like that. But for this, I think this just really suits kids. You know, they are Children's Commissioner from Wales. I mean, it's got absolutely everything on here. So anyway, so I will I'll stop showing that now. But I just thought it was interesting to show you all.
Well, thank you, Claire. Thanks for sharing that with the audience. That's great. So yeah, if there's no further thoughts, we'll bring the webinar to an end, and thank Claire very much for her insightful presentation and all the kind of resources you signposted the audience to today. So thank you very much, Claire. We'd be grateful if everyone who joined the webinar today completed a very short evaluation, and a link will be sent to you after the completion of the webinar. And for those of you who aren't members of the network, we would encourage you to sign up to Public Health Network Cymru. And just to let you know that we actually have another webinar next week on the 15th, and that will be on social prescribing. So I hope you will all be able to join us for that webinar. So once again, thanks very much, Claire, for your time today, and I hope you will all join us soon. Diolch yn fawr, thank you.